of my other daughters for their sister and their mother. And I would like to thank all of you because you all helped too. Couldn't do it without you, don't you know it? Thank you very much.
I founded Women's Collective 6 years ago after finding that I was HIV positive. Now, I'm not only an advocate for myself, but for many other women as well. And if you ask me what the Women's Collective done for me, first, they've given me a voice. Second, they set me on a career path. And thirdly, they've taken away some of the stigma that I placed upon myself and that which society has placed upon people who are infected. These are the things that the Women Collective does, not only for me, but for many other women who walk through our doors.
I am honored every day that I walk in and see that there is a safe place. There is a place that women can come to and get what they need. The very things that I didn't have when I was diagnosed. So it gives me great honor and pride to see that there is now some place that as you're diagnosed, you can come to, and we will give you care with love and dignity.
Say that again. Faith in one another and faith in ourselves. Yes. Faith in ourselves.
When I was diagnosed in 1986, they didn't think women got HIV or AIDS. It's now the leading cause of death for Black women between the ages of 25 and 34. This is the reason the Women's Collective exists and why we must be here. One of the unique things about the Women's Collective is that we provide services which a lot of people do. Case management, mental health, support group, all of those services. The thing that I think we do that's unique and different is in between all of those services, we provide lots of nurturing, self-esteem building, empowerment, so that women feel worthy and good about themselves. We do our best to make it a safe space, a loving space.
If it doesn't work out.
We have three arms to the agency. We have the care side, where we take care of women living with HIV, providing them services. We have the prevention arm to the agency, where we get women tested, give them information, education, the tools to practice safer sex. And then we have an advocacy department in our agency.
If you're going to talk to a community center, if you're going to talk to a church for the first time, is that this epidemic is now hitting women, and it's hitting women of color.
One of the example of our care side would be the coffee house. That's our support group, which actually started the Women's Collective.
And I lost my arm, and I lost my back, and it's really hard some days just to keep on.
The things we have in common, you know, I talk about my own story. I never thought this would happen to me, like most of us. I was married for 10 years, and after the birth of my third child, who was born very sick. And by the time she was about 2.5, my husband began to get very ill. He died on January 1st, New Year's Day, 1987. And 6 months later, I lost my precious daughter. And at the age of 29, discovered that I too had AIDS. I had no T cells, I was 80 pounds, and I was told I had less than 2 years to live. And I looked at our family photograph of 5 of us. We didn't know this was in our household. We didn't know this was anywhere around us. That's my story, but really and truly it's not only my story, it's all of our stories. And you share your pain and you cry with people who are dealing with the very same issues like you.
Here at the Women's Collective, when a woman first comes into our offices, she's introduced to our space as well as to the staff. She's provided with a case manager. Her needs and the needs of her families are identified, and together they work on available resources in the community, such as housing, food, emergency financial assistance, and utility assistance. Because we're family-centered, our services extend not only to the woman, the initial client, but also to her self-identified family members. Here at the Collective, we have a resource room. We have computers that are in there that are internet accessible. She can do job searches. She can do research around her disease. We have a community kitchen. Women can come in. They can prepare breakfast and lunch food items. They can also enjoy the resource room in terms of rest.
We also have a mobile unit that's out in the street testing women and their families.
I care about these people because I'm one of them. How you doing?
Hi ladies, how y'all doing?
Our testers and our outreach workers are people who are from the community, who are like the community, some of them who are HIV positive.
At first when my husband died, I wanted to die, because I felt like, I didn't know whether I gave it to him or he gave it to me, it was like that. And I just wanted to die. By coming to the Collective, with the case manager, I had to learn how to love myself. And that's why I'm so grateful that I'm able to come out and help somebody else, to save their lives.
Intertwined between all of that hard work that we do is some fun, wonderful activities that bring joy to the women. For example, Spa Day. It's a day that the organization provide pedicures and massages, facials. The lights are off and the women come in and they're treated very special, like you are worthy. We appreciate you.
I founded Women's Collective 6 years ago after finding that I was HIV positive. Now, I'm not only an advocate for myself, but for many other women as well. And if you ask me what the Women's Collective done for me, first, they've given me a voice. Second, they set me on a career path. And thirdly, they've taken away some of the stigma that I place upon myself and that which society has placed upon people who are infected. These are the things that the Women's Collective does, not only for me, but for many other women who walk through our doors.
I am honored every day that I walk in and see that there is a safe place. There is a place that women can come to and get what they need. The very things that I didn't have when I was diagnosed. So it gives me great honor and pride to see that there is now some place that as you're diagnosed, you can come to, and we will give you care with love and dignity.
Say that again. Faith in one another. And faith in ourselves. Yes. Faith in ourselves.